Lights don't whiten your teeth. You've probably seen ads and videos showing lights promising dramatic whitening. The truth is, the peroxide gel is what actually whitens the tooth structure, not the light. Today, I'm going to cover the science of whitening, compare in-chair power sessions with at-home trays, what I actually recommend for my patients, sensitivity and how I manage it, what to do if you have a single dark tooth, what to do if you have white spots on your teeth, what you should and shouldn't eat while you're whitening your teeth, whitening toothpastes, and those blue gels you've probably seen on social media, how long whitening actually lasts, and how often you need to top it up. And I'm going to explain how to keep up the results. Whitening gels contain peroxide. When the gel touches your teeth, the peroxide diffuses into the enamel and dentine and creates reactive oxygen species, and they break colored molecules into smaller, less colored fragments. That is whitening chemistry in a nutshell. So what about the lights and the lasers? They mainly add heat. Now, heat can speed up a chemical reaction, so the teeth whiten faster. But the final color change still comes from the peroxide chemistry, not from the lamp. And lights are linked with more sensitivity for lots of people. I've linked some studies in the description if you want to check them out yourself. High quality reviews show the end result is similar whether you're using dentist-made trays at home or have an in-chair whitening session. In-chair can certainly give you that quick bump up in shade. But a lot of that first day wow is actually dehydration of the teeth and surface optics, which fade within a day or two. So choose based on your timeline and how much sensitivity you're happy to risk and accept. So what do I actually recommend most of the time? I usually start with custom trays that fit accurately. We'll use either carbamide or hydrogen peroxide and pick a routine that is going to limit your sensitivity. The big lever here is contact time. A lower concentration used for a longer time can get you to the same end result with less sensitivity than higher strengths used over shorter periods of time. So I prefer to start on the lower strength gels and increase only if you're comfortable. And it's worth noting you do need well-fitting trays so that the gel stays inside the tray. You want to use tiny pea-sized beads per tooth. Don't chase sensitivity as a sign of the gel's working. So, sensitivity. Most of the sensitivity from whitening is hydrodynamic. And what's happening is that there's fluid shifting in the dentine which stimulate the nerve. Now, to manage it, there are various desensitizing agents that you can use. Generally, they're going to contain potassium nitrate and fluoride, and that helps calm the nerves. And as we've mentioned, you can adjust wear time and the concentration to find a comfortable routine. The evidence shows that these steps reduce sensitivity without reducing whitening. Again, I've linked studies to this in the description if you want to read about it yourself. When do I still use an in-chair session? If you need a same-day lift, for example, you got a photo shoot tomorrow, then you may want to have a brief in-chair kickstart and then move onto trays to help stabilize the color. The deeper and more stable change still comes from the peroxide over time, not from an hour under a light. Okay, so what if you have a dark tooth? Should you still bleach everything? If one front tooth went gray after, say, a root canal, you're not going to want to bleach everything. In that case, you need to look at some type of internal bleaching from the back of the tooth. I will also be honest with you, it can be really difficult, almost impossible to get a perfect match when you're whitening your natural teeth next to a discolored tooth. And to get a perfect match, you might need more restorative treatment. For example, composite bonding, veneers, or a crown, rather than just whitening. So it's something to speak about with your dentist. What if you have white spots? Should you bleach first, or is there something else? So white spots can look brighter right after whitening and then settle down. You can look at other options instead of whitening. For example, resin infiltration and also microabrasion. Again, you're going to want to speak to your dentist if you have white spots on your teeth because they'll be able to best advise you on how to manage it. Clinically, everyone's teeth look that bit different, and some people you might be able to manage it with whitening. And for other people, depending on the result you want, you might be better served with one of the other treatment methods. Again, if you do have white spots on your teeth, I've linked some articles below. Now on to what you should eat and drink while you are whitening your teeth. Do you really need a strict diet while you whiten? Short answer is no. So the oxidation that whitens your teeth happens inside of the tooth. Colored foods and drinks mostly affect the surface layer on the teeth, and the best evidence says that you don't need a strict white diet. If you want to, you could rinse immediately after having any dark drinks, but the main lever to the color is simply using the gel consistently. And what about whitening toothpaste and those blue gels that you've probably come across? So let's start with whitening toothpastes. Most whitening toothpastes are actually really quite abrasive, and they can lift surface stain if you have it, but overusing these pastes can wear the surface of your teeth and make things worse over time. The blue gels that use blue coverine, they lay a thin film on the teeth that shifts the visible light reflected from them onto the blue end of the spectrum. So your teeth will actually look whiter straight away. But that is an optical effect. It is not coming from an internal change in the color of the tooth, and it is short-lived. It's going to go within a few hours, maybe a day if you're lucky. So it can be useful for a quick photo, but not a replacement for peroxide gel if you're looking for any medium to long-term stable results. And that leads us on to how long does whitening last and what type of maintenance protocols should you follow? So here it's worth noting that the shade of the teeth will drift slowly with time. So the easiest way to maintain the shade is with simple top-ups. 1 or 2 nights in your trays after your hygiene appointments or before any events. And it's worth also noting that if you're planning bonding or veneers, you're going to want to make sure that you've stopped your whitening about a week to 2 weeks before to make sure that actually the adhesives bond properly to the teeth. And how long does whitening last and how often should you top it up? Most people will hold the result for about a year. Teeth typically stay lighter than baseline between 12 to 24 months after using these peroxide gels, and many stay stable for up to 2.5 years. If you drink a lot of coffee, tea, or red wine, or you smoke, you might want a few more short top-ups over the course of a year. So my advice is that if you want predictable whitening with minimal sensitivity, start with custom trays, use lower concentrations for longer periods of time, and adjust with desensitizers if you need them. If you have one dark tooth, address this probably internally first, and your dentist will advise you on that. If you have white spots, you can use a combination where you blend first and then you brighten, and you don't need a strict diet while you're whitening. Live your life. If this has helped, press subscribe, turn on your notifications, and tell me in the comments what you want me to cover next. I have linked every study in the description, so you can check the evidence yourself if you want to have a look.